Viewers and listeners, I am Ibrahim from Faculty of Veterinary Medicine, Ahmadu Bello University, Zaria. Today we are honored, fortunate, and privileged to have one of our senior lecturers, Professor Salisu Ibrahim, who is an expert in the field of emerging infectious diseases and veterinary epidemiology. So you're highly welcome, sir.
Thank you very much.
We're also grateful for honoring our invitation despite your busy schedule. So I would like to begin this interview by asking what are the major breeds of cattle we have in Nigeria?
Well, generally the breeds of cattle are divided into two. We have Bos taurus, which is the foreign breed, and then we have Bos indicus, which is the local breed. We have is popularly known as Zebu. We have breeds like White Fulani, which usually they have large body, large horns, and they are white. And you usually find them around Plateau area, Plateau State, Nasarawa, and other part of North Central. Then from there we have the Sokoto Gudali, which they are homeless. They don't have horns also, and usually they are white to some white and few patches, black patches. They are found around Sokoto, some part of Kanu, Northwest. You find them there. Then the next one we have Rahaji, which is the red Fulani. They are red in color. They have large horns, and usually you see them around Jigawa, Kano State. You see them. They are red in color. Then we have the Adamawa Budali, which you usually also find around Adamawa and Mambila Plateau. These are generally the major breeds we have, especially in this country, which is short, homeless, and they are stout. They are big, but they are short. They are not as tall as Rahaji. And those ones, you find them mostly around the southern part of the country, like southwest and some part of south. Some of these breeds. These are the breeds we have in this country. Then sometimes, as I said, we have the European breeds. We have the this thing, interchanging of this thing. You buy, let's say you get a white Fulani and you crossbreed it with Prisian. So we have some few packets of breeds which are now as a result of crossbreed. So we call them crossbreeds. And those crossbreeds, you can find them all over the country. As I said, you can get a white Fulani and get a Brahman, or you get all these South European breeds, and you now crossbreed them. So the offspring are called crossbreeds. So you have them all over the country. Generally, these are the type of breeds we have in this country.
Thank you, sir, for the broad classification. So what are the major diseases destroying our cattle population in Nigeria?
Most diseases disturbing our cattle in this country, we have contagious bovine flu pneumonia, we have FMD, foot and mouth disease, we have anthrax, we have majorly the ones I have mentioned. They are the ones that are devastating the cattle mostly.
Okay.
Yes.
Yes, so among these diseases, which one are vaccinable and which one are not vaccinable?
Generally in Nigeria, we have 5 vaccinable diseases. We have CBPP, which is contagious bovine flu pneumonia. We have FMD, we have anthrax, we have hemorrhagic septicemia, and we have black water. These are the most routinely vaccinable diseases we have in this country.
Okay, so what is the best age to vaccinate our cattle, and why do we vaccinate our cattle annually?
We usually vaccinate. Vaccines are protective. And the reason why we vaccinate our cattle is protection, is to protect the animal from being infected by these organisms. Yes.
Yes, sir. So I heard of a word transboundary animal disease. Could you share more light on that?
Transboundary animal diseases are diseases that are transmitted through boundaries. That is, let's say, between Nigeria and Niger, as a result of cross-border.
So from our previous knowledge, and as we earlier said, we have vaccinable diseases. So we are meant to understand that trypanosomiasis has there is challenges in producing the vaccines, and then due to the antigenic variation. So then I want to ask, what is the best preventive measure against this disease?
Against trypanosomosis is usually there's what we call prophylaxis treatment. Maybe you are moving your animal to a infested zone. So what you do is you treat prophylactically. That prophylactic treatment is usually we have drugs like isoniazid. So you give half of the dose you are supposed to give when an animal is diseased. So all these our pastoralists, when they are moving, especially from the north down south, we encourage them to do this pre-plastic treatment so that it can protect the animal from being infected.
Okay, so
Yes.
So how is rabies manifested in cattle, and how do you differentiate it from other diseases affecting the brain like caudilosis and anaplasmosis?
Usually, rabies in animal, especially in cattle, is almost closely related with the clinician. There is change of behavior, and then the madness will set in. That is aggressive, attacking all moving objects, and you also muscle tremors, convulsions, and so on. But you can differentiate rabies from diseases like caudilosis. In the first place, caudilosis is caused by Ehrlichia ruminantium now, which is a bacteria. Rabies is caused by a virus, which is a rhabdovirus. And clinically, the nervous manifestation, especially the mania, the madness, is absent in caudilosis. And also, caudilosis, usually you will find tick infestation, and it is the result of bite from an infected animal. So there is that history of either bite or fighting or something, a rabies, which you cannot see in caudilosis. Yes.
So lastly, as an experienced large animal veterinary practitioner, so what advice or opportunities do you suggest for a young veterinarian or a new graduate from veterinary medicine who wants to specialize in large animal practice?
I will always like to encourage our people to enter into large animal practice because this is the right time Nigerian livestock industry needs them. We have very few veterinarians in the country. In fact, statistically, you will find out one veterinarian to almost 50. There are some NGOs which usually, especially when it comes to artificial insemination services, you can also do that. We have feedlotting, where you fatten the animals, you sell them, and you get money. And there is also a private practitioner. As a clinician, you open a clinic where you will be treating all sort of diseases, especially as it relates to our cattle, and also uh, ambulatory services. Even though we have some security challenges we are facing in the country, but if it were before, when the security challenges were our veterinarians, especially the younger ones who have the energy to enter into these bushes and treat those animals, you will definitely going to make it based on that.
Thank you very much, sir. Thank you for your time and your efforts for giving us the opportunity to come and draw from the sea of your knowledge. Indeed, it was very insightful and educative. Thank you very much once again, sir.
Thank you very much. Thank you.